Syphilis. Syphilis is caused by the Treponema pallidum bacteria. There were 46,042 reported new cases of syphilis infection in 2011. Syphilis is transmitted from person to person through direct contact with syphilis sore. Syphilis sores mainly occur on the external genitals, vagina, anus, or in the rectum. Sores can also sometimes be on the lips and in the mouth. There are two stages in syphilis. Syphilis is easy to cure in its early stages. Primer stage. Appearance of a single sore marks the first stage of syphilis symptoms. Sores will appear where the syphilis entered the body, and most times these sores are painless. Then usually last from 3 to 6 weeks, then goes away whether or not the patient is treated. In the secondary stage, more sores and rashes begin to appear. Rashes appear in the palms and bottom of feet. Pregnant women with the disease can pass it on to their unborn child. Early symptoms include skin rashes, inflated lungs, runny nose, swollen lymph nodes, anemia, enlargement of spleen, liver, and jaundice. Later symptoms include saddle nose, abnormal upper incisors, deafness, seizures, mental retardation, paralysis, saber shins, and dislocated joints. In 2008, 63% of people with syphilis were among men who have sex with men. During 2004 to 2008, rates of primary and secondary syphilis increased the most among 15 to 24-year-old men and women. Human papillomavirus. HPV is a sexually transmitted disease. There are more than 40 types of HPV that can cause serious health problems in both male and females. HPV is the most common sexually transmitted infection and is the main cause of cervical cancer in women. While HPV is also very common in men, most do not develop any serious health problems. About 20 million people in the U.S. are affected. HPV is so common that nearly all sexually active men and women get it at some point in their lives. HPV is passed through genital contact, most often during vaginal and anal sex. HPV may also be passed on during oral sex and genital-to-genital contact. In rare circumstances, a pregnant woman with genital HPV can pass the HPV on to her baby. Symptoms include both genital and throat warts, cervical cancer, and other genital cancers. There is no cure for HPV, but there are ways to prevent it. There are vaccines against HPV. For women, symptoms include both genital and throat warts, cervical cancer, and other genital cancers. There are vaccines against HPV. For women, two vaccines are available. They are Cervarix and Gardasil. These vaccines help protect females against cervical cancers that can be caused by HPV. For men, only one vaccine is available, Gardasil. Gardasil helps protect against genital warts and other anal cancers. So, wrap it up or zip it up. By the way, with a lot of different STDs, women are at unique risk for infection in comparison to a man. This is because the vaginal lining is thinner and more delicate than the skin on the penis, so it is easier for bacteria and viruses to penetrate. The vagina also serves as a good environment for bacteria to grow. Women are also less likely to show symptoms for common STDs like chlamydia and gonorrhea compared to men. Women also tend to confuse the symptoms of some STDs for the symptoms of something else. For example, discharge in a woman is very normal and burning and itching is usually thought of as a yeast infection. In women, it is much harder to see the symptoms because of the placing of the reproductive organs. STDs can later affect a woman's ability to reproduce if left untreated for too long. If a woman is pregnant, she can pass the STDs to her baby.